and welcome to Worldwide News. My name is Tim Tomlinson.
And I'm Donna O'Donohue.
And today on our special report, we're going to talk about factitious disorders. A factitious disorder is a condition in which a person acts if he or she has an illness by deliberately producing or exaggerating symptoms.
Factitious disorder imposed on another is a condition in which a person deliberately produces, feigns, or exaggerates symptoms of someone in his or her care.
Munchausen syndrome is a severe form of factitious disorders, which was the first kind identified and for a period of time was the umbrella term for which all disorders that fell under it fell, but they're now categorized under factitious disorders.
So today, our news team traveled to a local hospital to find out more about factitious disorders and their meanings. Take a look.
Burke's patient, Kalpana Veera.
Kalpana, named by villagers in Nepal.
She presents with multiple syncopal episodes and ventricular arrhythmia.
So you've been passing out?
Yeah, and having palpitations.
Past medical history of rheumatic heart disease with mitral valve stenosis.
They had to ship me from Zambia to the States for 3 months of treatment when I was 8. Rheumatic fever almost killed me.
Dr. Stevens, what are the primary causes of ventricular arrhythmias?
Valvular disease, mitral valve prolapse, stimulants, drugs, and metabolic abnormalities.
Scrub nurse to OR6.
What? Out.
I saw that. I saw you take that pill.
Oh, it's my pill, you know, the pill.
It's not in your chart, and you're supposed to tell us all the meds you're on.
You're not my doctor. You shouldn't even be here.
She's right. You shouldn't be here.
I saw her take unauthorized medication.
I'm on the pill. And I had grapefruit juice this morning. Since the juice inhibits enzymes involved in the metabolism of OCPs, I thought I'd avoid the interaction by taking it 2 hours after my meal.
She has a doctorate in neuropharmacology, Christina.
Well, Izzy, I don't see oral contraceptives.
Okay, well, now you will. Would you just go back to bed and stop trying to poach my patients? This is ridiculous. Could you just go back to bed and stop poaching my patients? It's not a... She's in BFib. Call the code.
Code blue, second floor. Second floor.
No code?
Not anymore. Can you help us get her back in the bed?
I'll help. Just give me a minute.
Would you just go back to bed? Please, seriously, go.
Oh, God. You know, Izzy, if she's on OCPs, can we mark it down, okay?
Yeah.
You scared us a little there. How's the workup coming?
Electrolytes are within normal limits. Urine tox was negative and EKG's fine. Till test is scheduled for noon. Oh, and she's on contraceptives.
So?
That's what I said. Other doctor made such a big deal of it.
She didn't tell us before, so I documented it in her med list.
What other doctor?
Christina, she was wandering the halls.
Fine. Take her down for an echo.
An echo? What about cardioversion or ablation? Won't I need a pacemaker or a permanent internal defibrillator?
Although it would be unusual for rheumatic heart disease to cause ventricular dysrhythmias, we still got to check your valves.
I thought your doctorate was in neuropharmacology, not medicine.
It is.
It's odd.
It's odd that I'm not jealous.
No, you have every right to be jealous. It's your territory, and she's peeing all over it. What's odd is Burke's patient. She's been in 4 other hospitals this year. You know, something's not right. Hey, Izzy, how have her studies?
Hey, I have been looking for that everywhere.
Negative, right?
Oh, the echo test showed mild mitral stenosis. The TIL test was negative. We're doing EP studies.
I can tell you what's wrong with her without sticking electrodes in her heart.
Really? Just by the chart?
No, from the pill she took.
They were contraceptives, Christina. Why are you so obsessed with this? Just go back to bed.
I think she's doing this to herself.
You think she's inducing ventricular arrhythmias? She'd have to be crazy.
Wasn't that interesting how she was faking her symptoms to receive special attention from her doctors?
Yes, very much an eye-opener, Tim.
Thank you, Donna.
People with this condition may produce symptoms by contaminating urine samples, taking hallucinogens, injecting themselves with fecal material to produce an abscess and other similar behavior.
We're going to take a short commercial break, but when we're back, we're going to hear from special guest, Dr. Peggy Pagelson, and her assistant, Betty Crocker.
Have you or a loved one been affected by factitious disorder?
Do you find yourself faking symptoms to get attention or drugs from doctors?
Well, we have the solution for you.
Crystal Water Springs Factitious Disorders Rehab Center.
Your one-stop place for rehabilitation. The following are patients of Crystal Springs Rehabilitation Center, and these are their stories.
So tell us how Crystal Water Springs has affected you and your disorder.
It has really impacted me. Without this, I would probably be the same old person in the hospital faking my disorder to get drugs and attention. So tell me, why did you feel the need to fake your disorder? All through my high school career, I was that ugly girl with a receding hairline. So I decided I needed to take action against this. I didn't want to be the ugly girl anymore. So I went to the doctor to get a prescription for testosterone pills to make my hair grow. Well, it got a little out of control, but I'm so glad that I found Crystal Water Springs, because when I am in this center, I feel like a normal girl and no one calls me ugly receding hairline girl.
So tell us where you were before Crystal Water Springs.
I was in a hospital trying to get drugs and attention from others in the worst way possible.
And where are you now that you have checked into Crystal Water Springs Rehabilitation Center?
It has definitely changed everything in my life. Everyone is so nice to me here, and I just feel so safe and so comforting. And I just can't imagine without it.
Do you feel that you've received the attention that you felt you needed while taking these drugs at the rehab center?
Absolutely. Crystal Springs has made all the difference. It's made me feel loved and warm, like my mother used to before she died. But now, I found hope. Hope in a place that goes beyond just checking and making sure you're okay. A place that really goes the extra mile to make sure that you feel safe and warm. Thank you so much, Crystal Springs. You've made all the difference.
So if you or a loved one has been affected by factitious disorders,
Call 1-800-GET-HELP. Crystal Water Springs Rehabilitation Center is there for you.
be the best you.
Hi, my name is Donna O'Donohue, and I'm here with Dr. Peggleson, an expert on factitious disorders. Dr. Peggleson, what are the causes of factitious disorders?
The exact cause of factitious disorders is not known, but researchers are looking at the roles of biological and psychological factors in the development of these disorders.
And how common are they throughout the world?
Well, there are no reliable stats regarding the number of people in the U.S. who suffer from them, but more common in men than women.
All right, and how are these people with factitious disorders usually diagnosed?
It can be very difficult, and there's a lot of dishonesty. So first, the doctor must rule out other possible physical and mental illnesses. If the doctor finds no physical reason for the symptoms, the results may be self-induced, and he or she may refer the person to a psychiatrist.
Wow, that was a very in-depth conversation, Dr. Peggleson, and I'm going to thank you for being here with us today and telling us more about factitious disorders. Back to you, Tim.
We're here with special guest Betty Crocker to ask her a few questions about factitious disorders. What types of factitious disorders are there?
Well, there are 4 main types of factitious disorders. The first one has psychological symptoms. Individuals could have schizophrenia, confused thoughts, and make absurd statements. Another one is physical symptoms, where they could have chest pain, stomach problems, or a fever. Another one is both psychological and physical symptoms, and the other one is otherwise specified.
Very interesting. Now, how are they treated, Betty?
Well, you cannot treat it with medication, but there's a lot of therapy for it, and they actually recommend family therapy for reinforcement and avoiding the individual.
Thank you very much for your time, Betty.
Yeah, thank you for having me.
Well, today you learned all about factitious disorders. My name is Tim Tomlinson.
And I'm Donna O'Donohue.
Thanks for tuning in. Until next time, stay happy.
Worldwide News.
The doctor finds